Hi, I'm Dr. Eric Surrey of CCRM Colorado, and I want to take just a few minutes to chat with you about what you can do to get ready for fertility evaluation and what that evaluation would include. During these difficult times, we are certainly available and open and happy to welcome you in for starting an evaluation for your infertility needs. Before coming in, however, I think this is also a very good time to help with general health, to consider discontinuing alcohol intake, getting your weight to the right place, increasing exercise, to get your pap smear, mammogram if appropriate, vaccinations, just so that you're all ready. It'd be wonderful for your physician to be able to review any past records that you have. That makes it more efficient for us, and we can advise you a little bit better when you do come into the office. As far as our evaluation, which we can often also offer by telephone and telehealth during this pandemic, the physician will chat with you and your partner, if there is one, regarding your past history, past therapy, other health issues. I think it'd be very important if you do have a partner for that partner to be with you during that initial evaluation. It allows us to do a better job. Now, each evaluation is tailored to an individual, so I'll just give you some general ideas of the kinds of things that we may recommend to you. This would start by including various preconception laboratory tests, making sure that your pap smear is up to date and normal, that you've had up-to-date mammograms, what we call preconception laboratories, testing including general blood counts, chemistry panels, your vitamin D, thyroid levels. Most women we would want to evaluate for Ovarian Reserve, which are a set of blood tests that look at a sense of where you stand with regard to your ovarian function compared to other women your age. This is a set of blood tests that are typically done on the second, third, or fourth day of a menstrual cycle, and usually coupled with an ultrasound examination. That examination allows us to count how many eggs are available for use in a given month, what's called an antral follicle count, and also allows us to evaluate any abnormalities in the ovary or uterus. If you do have a male partner, we will request that a semen analysis be performed. There may be additional sperm function testing that is recommended as well based on any given circumstance. Oftentimes, if this has not been performed previously, we will recommend what is called a hysterosalpingogram, or HSG, which is an X-ray in which a small catheter is placed in the uterus, a dye is injected, and this confirms that the fallopian tubes are open or closed. And this is even a critical component of the IVF process because there are certain types of tubal blockage that can have an impact on the ability of an embryo to implant. For individuals who are going through in vitro fertilization, we may request additional evaluation of the uterus, particularly what is called a hysteroscopy, which is placing a small telescope inside the uterus to evaluate the cavity, making sure that there's nothing that would prevent an embryo from implanting. We would ask you that day to meet with your nurse, your primary nurse. We'll be able to set up a follow-up to go over outstanding test results and create a plan that is individualized for you and your partner as appropriate. There are certainly our mental health counselors that are available for you, particularly in these incredibly stressful times. If you are considering genetic testing of embryos, we will have you meet with genetic counselors who will let you know what's involved with chromosomal testing, or so-called CCS, of embryos as well. We want the evaluation process to be as low stress as possible, but do be prepared to get an awful lot of information. That's our job, to not only take care of you, but to make sure that you're well informed. There is always opportunity for follow-up to make sure that any questions that you have or anything that you don't understand is answered, so that an appropriate treatment plan can be put together for you and your partner that is comfortable for you to help you achieve your goal in as efficient a way as possible of creating a family. So we look forward to seeing you and look forward to speaking to you soon.